Chances are you've heard a variety of opinions about wisdom teeth, like when they come in, whether they need to be removed, and when they pose a problem. And here to clear it all up for us are two authorities on the matter, Dr. Kurt and Caroline Kaser. Thank you guys so much for joining us today.
Thank you for having us.
Pleasure to see you again. So we're talking about wisdom teeth. It's something that maybe a lot of people dread in their lives. You know, do I have to get it out? Can I just let them, be inside my mouth? But what's the truth about it? When do they actually come in? When do they start posing a problem?
Well, sure. A lot of times we see problems going to start between 15 and 25. Most patients come in with pain and result to an infection or a cavity in the adjacent tooth, probably in the late 20s. And so what we try to do is avoid that, take out the teeth before, and make sure that the surgery goes nice and smooth.
Got it. And so when do people know that extraction is actually necessary? I mean, we're talking about the infections, we're talking about the pain, but what if there isn't any of that?
So typically you have to see either a dentist or oral surgeon to go in and take a look at your x-ray. And once they took a look at the x-ray, then they can point out the angulation of the teeth exactly.
Got it. And so let's talk about the risks associated with it. Like with any type of surgery, any type of procedure, there may be some risks along with it. What can you tell people to expect?
Well, typical risks with any surgery are like pain, bleeding, infection, and swelling. One typical topic that we talk about is a nerve that runs alongside of that tooth. And then when you just wiggle that tooth just a little bit, sometimes it can push on that nerve and cause a little bit of numbness here in the chin. And there's also a little risk of anesthesia. Most of my sedations, the patients are breathing on their own. They're in one of that type of general anesthesia where they're deep enough, but they're light enough that they're breathing on their own is where I like to keep them.
Got it. And of course, when I got mine out, they just sort of left the holes, for lack of a better term, just open, and you're supposed to keep it clean, and you're supposed to...
With your little syringe?
Right, your little curved syringe, a little salt water.
We still do that.
You still do that, but are there other types of methods that you use? Do you close any up? I mean, how do you decide?
So the idea of keeping the hole open is to prevent infection. So once you close over that hole, let's say that your teeth were poking through the gum, now you have this bacteria in your mouth exposed actually to the inside of that hole. And what happens is if you just close over it, you're trapping in that bacteria. So we do have a reason for leaving the hole, and it's to prevent infection.
Right. And as an oral surgeon, you're the one that's, of course, doing the surgery, getting these wisdom teeth out. But Dr. Kurt Kaser, how do you know as an orthodontist that someone should be referred to an oral surgeon to get their wisdom teeth out?
Yeah, and that's what we see a lot. So our typical age is about 12 to 15 years old that people are going through treatment, and so as we finish up our orthodontic treatment, that's the natural transition as we get into retainers to hold our results. The wisdom teeth can impact that. So a lot of our referrals go out at the end or the second half of orthodontic treatment out to the oral surgeon. And that's one of the reasons with OrthoPros and Dental Pros, that was a nice transition to have an oral surgeon come in-house and in the building, so we can also do those services right afterwards as well.
Right. You have a team behind you. You have all these professionals looking out for your well-being, looking out for the health of your mouth. I know a common misconception is that the older you get, the more difficult this type of surgery can be. Or is that a misconception?
No, it's an accurate interpretation. Typically, patients who are older, one, they don't heal as fast as they would if they were 16. And two, our tolerance levels are a little bit high, so the last thing we want to do is baby a couple of wounded teeth here and not be able to chew or eat our morning coffee and all that stuff. So typically we like to do it earlier.
When you talk about the recovery taking longer as you get older, but what's a regular recovery? What's the length of a regular recovery?
My kids that are around 15, 16 years of age, I would say 2 to 3 days.
Okay.
As you go into adulthood, like 35, 40, it's probably almost a week. And high risk of dry socket, which you've probably heard about, is higher as well.
Right. And so, Dr. Kurt Kaser, if someone, wants to get this done, if they need to get it done, what should they consider when they're looking at different oral surgeons?
Yeah, I think just having a comfort level with the oral surgeon, right? I mean, that's what they're trained in, so that's the person to go to for those. With us, obviously, with Caroline, being the wife, that relationship's there.
Yeah, having a female blonde hair. No, just kidding.
Yeah, so in our office, we just had so many people who say, hey, we love your office, we love what you do, we love the people, we want to stay here, what can we do? So that, for us, that's sort of how that evolved, right? With the hygiene and with the oral surgery side, just to keep that in-house, keep those relationships, because really that's what people are looking for, right? Do I trust you? Am I comfortable with you? Do I know you're going to take care of me the way that I want to be taken care of?
Exactly. And Dr. Caroline, is there people, they may have them in their mouth, is there an opportunity for them to say, keep their wisdom teeth? Do you see any reason for them to keep them, or do you tell them, get it out.
Yeah, no, well, there's some, in some instances, the body has enough room in the jaw and the teeth can come up straight and the nice tissue can form around it, but
Right.
it's very rare at this point in time. I think evolution's taking over and we're starting to lose space in our jaw for these
Right.
teeth. So like a million years, we'll probably be without a job.
Right.
You know, we'll be taking out wisdom teeth, but until then.
Until then, everybody should get it done. It's a matter of oral health, and like you say, having a network of doctors all sort of looking out for you, making sure that you're making the right decisions, and also getting those teeth out for you to be a lot healthier is very important. So I want to thank you both so much for joining us. Very important information for people, and hopefully they get their teeth out. Thank you.
Yeah, nice
Thank
to meet
you.
Thank
Nice
you.
to meet you. OrthoPros has you covered with dentistry, orthodontics, oral surgery, and pediatric dentistry. To find a location near you or to learn more, call 520-290-8787 or visit orthoprostucson.com.